Welcome back, everyone. I hope you had your coffee, your pastries, and that you're ready for the next session. And again, thank you for joining us, for being with us. We are starting now the second part after the coffee break. The second part is on hospitals. So what the hospitals had gained from the project. Each partner country will describe the activities and goals achieved in the hospitals as a result of joining the project and producing the training package. This part is dedicated to the hospital partners and those who develop the online learning program on nursing research and research platform and learning evaluation. I was supposed to have a colleague here, Miss Liz Kingston from Ireland. It's a pity she couldn't join us, so I will be inviting the speakers by my own. And I suggest that we start. So first scheduled is Jennifer Khan. Jennifer Khan is coming from Limerick Hospital in Ireland. Welcome, Jennifer. Thank you.
Thank you very much.
And she will present us the experience of Irish Hospital, a guidance for conducting journal club and research groups. My suggestion is open your ears because this will be practical suggestions how to construct journal club and research groups in your hospitals. Please, Jennifer.
Thank you very much for that lovely introduction. Good morning, everyone, and I am delighted to represent the University Hospital Limerick Group at your International ProCare Conference today, and congratulations on your project. It's a fantastic initiative and well done, and I was very happy to support my colleagues in the University of Limerick and work with you on this project. So I am going to talk you through our experience in University Hospital Limerick in facilitating and developing a journal club for our nursing staff within our hospital group. Marco, you can move the next slide for me, please. Thank you. So firstly, the purpose of a journal club. So firstly, just a little bit of background into journal clubs before I go into my presentation. So journal club is very much linked to the medical model of care, and Sir William Osler in 1875 first developed the journal club in Canada. However, there has been a growing body of research developed in relation to the development and the benefits of a journal club within other professions, i.e. the nursing profession. And we in University Hospital Limerick, with our colleagues in the Department of Nursing and Midwifery in the University of Limerick, came together and established our journal club in March 2014 for University Hospital Limerick Group. And we very much did this in a collaborative and engaging framework with our colleagues in the University of Limerick. So firstly, we established a committee, and a working group came together which consisted of nursing colleagues from our clinical practice areas within University Hospital Limerick. So we had representation from clinical nurse managers, registered nurses, advanced nurse practitioners, and clinical nurse specialists and clinical skills facilitators. And at our first meeting, there was a really strong desire and commitment by all present to establish a journal club for our hospital, and we proceeded. We identified terms of reference for our working committee group, which was really important, and we discussed what was the purpose of a journal club. So firstly, the journal club, we believe, provides an open forum for nurses to meet and critically evaluate nursing research. Journal clubs enhances and develops nurses' critical appraisal skills. And we were very conscious in the group in relation to the word critical appraisal skills, because sometimes that can be quite daunting for nurses. And we were very conscious that we would have different levels of experience and expertise within our journal club committee and within our journal club structure. We wanted to provide an opportunity for nurses in a variety of roles to collaborate, critique, and discuss how nursing literature and research can be translated to clinical practice and patient-centred care. So how does nursing literature and evidence-based practice support the delivery of safe, high quality patient care, with care and compassion being at the centre to everything that we do as nurses. Journal clubs bridge the gap between theory and practice, and journal clubs support nursing staff to be informed of evidence-based practice. And evidence-based practice has been shown to improve patient care and patient outcomes. Journal clubs support the application of scientific evidence to improve and promote clinical practice, as identified at the opening address of this morning's conference. Next slide, please. So our journal club structure. How did our journal club emerge and develop? So after our first consultation meeting with the key stakeholders that I mentioned at the beginning of my presentation, we identified that a presenter was required for each journal club meeting, and the role of the presenter is to lead on their chosen article and critique it to the attendees who attend the journal club on the day. A leader is required for a journal club, and I was appointed as the leader for our journal club in University Hospital Limerick. And my role, in consultation with my colleagues, was firstly to coordinate our journal club meeting schedule. So we agreed as a group that our journal club should be held every 6 weeks. And that was to ensure that we had momentum and that we could see our body of knowledge and expertise grow each week, each 6 weeks, in relation to how we critique and review a research article. I liaised very closely with the presenters for our journal club. How did we choose our presenters? Really, from our first consultation meeting with those key stakeholders, a number of nurses within that group came to me and said they would really love to present at our journal club. Again, it was very important for the leader to ensure that that collaborative relationship remained, and that I engaged with presenters in advance of each journal club. And we outlined a journal club schedule 3 to 6 months in advance. And that's really important and key. And to ensure that you've got a backup presenter should anything happen to the original presenter for the journal club. I liaise very closely with our colleagues in the Department of Nursing and Midwifery in University of Limerick. And they were namely Professor Fiona Murphy, Professor Alice Coffey, and Dr. Pauline Meskel. And either Fiona, Alice, or Pauline would attend each of our journal clubs. And that was instrumental in supporting the critique and discussion of our journal club. And also it allowed our attendees to gain knowledge in relation to how to read and critique a journal club article. I also had the support of Geraldine Kennedy and Katie Tierney, our nurse practice development coordinators, and our journal club was endorsed by the Chief Director of Nursing and Midwifery, Miss Margaret Leeson, and the Directors of Nursing and the Assistant Directors of Nursing for our UL Hospital group. And without that support and commitment, it would not have been possible for us to develop our journal club. And then we supported the critical appraisal of the presented articles amongst attendees. We were very conscious about critical appraisal, and you'll see in my next slide that we'll talk a little bit more in detail about how we critiqued our article.
Jennifer, so we developed... excuse me, can I ask you, I didn't say at the beginning, we have a simultaneous translation, maybe just a step slower.
No problem, thank you.
Thank you.
So we developed a critical appraisal form. The purpose of the critical appraisal form was to provide structure to our journal club. It supported the presenters to critique the journal article, and it allowed attendees to gain some knowledge and experience in how to read and critique a journal article. Some of our attendees would be very experienced with critiquing journal articles, so this allowed the opportunity for everybody to grow their knowledge and expertise in what they had understood about how to critique a journal article. As you'll see from the critical appraisal form, we adapted this form from Hawker et al. 2002. And the critical appraisal form allows the presenter to talk about the authors of the article, the date of publication. We choose articles that were written within the last 5 years. The aim of the article is clearly identified in the critical appraisal form, and the research questions, if any, that were asked as part of the research study. We then worked down through the journal article in relation to the study design. Was it qualitative, quantitative, or a combination of both? The study session, where did the study take place? the sample size, the sample description, the methodology, and data analysis that was used within the study, how ethical approval was granted or achieved, the results of the study, and the conclusions. So we found this an excellent tool for us to use within our hospital to critique our journal articles. And you'll see on the right-hand side, each of the sections of the critical appraisal form were scored good, from good to very poor. The maximum overall score that an article would achieve at the end of the critical appraisal was 36. So it was a good way for us to develop questions that we could discuss in more detail after the presenter had critiqued his or her journal article. Next slide, please. So the journal topics that we have presented to date. This is just a snapshot of some of the topics that we have presented. So we have looked at the early management of deep venous thrombosis, the evaluation of kidney disease, education on clinical outcomes, stigma, shame, and blame experienced by patients with lung cancer, the experience of people with dementia and nurses within the hospital context, parents' routines for managing cystic fibrosis in children, and exploring person-centeredness in the emergency department, a literature review. From this slide, you will see that we've covered a broad range of topics, and that is key when you are facilitating a journal club within your hospital setting. You need to choose articles that will attract a large number of attendees. If we very much stick to specialist areas and specialist articles, you end up reducing the number of attendees potentially that may attend your journal club. Next slide, please. So our future development for our journal club. The COVID-19 pandemic did impact on our ability to continue to facilitate the journal club every 6 weeks. However, we are now progressing forward with the future advances with our journal club, and we have developed a new educational platform called NIP, Nursing in Practice. This will be facilitated across 2 clinical directorates monthly, and we are commencing our first pilot in April of this year. The aims and objectives of NIP. NIP will provide an opportunity for nursing staff to present topics of clinical interest to nursing colleagues within their clinical practice area. So we're going to be bringing the research to the patient's bed space, as opposed to the nurses coming away from the clinical area. It will provide nursing staff with a forum in clinical practice to share and discuss their expert knowledge in relation to patient-centered care. We are very fortunate within the University Hospital Limerick Group to have very expert, experienced registered nurses within each of our clinical areas. All of our nurses are qualified at degree level. So we believe that we have a wealth of knowledge and expertise in each of our clinical areas, and the objective of our Nursing in Practice initiative is to grow that culture of research and evidence-based practice and the sharing of knowledge with colleagues in the clinical area beside the patient bed space. NIP will also provide an opportunity for nurses to discuss how evidence-based practice can be translated to clinical practice. And that is key for our journal club and for our Nursing in Practice initiative. How can evidence-based practice influence the type of care that we give our patients, reflected through our policies, procedures, protocols and guidelines, and also reflected within our national and international guidance that we have and protocols that we have to follow to deliver safe, quality, patient-centered care. We have received Category 1 approval for this initiative through the Nursing and Midwifery Board of Ireland. So this also supports the continuous professional development of our nurses and nursing staff and colleagues who attend our journal club Nursing in Practice initiative will receive CPT credits for attending. Our Nursing in Practice initiative is also supported by with Magnish for Europe, and that's about growing a culture of evidence-based practice. It supports staff retention and recruitment, increases nurses' empowerment within clinical practice, and it leads to better patient outcomes and improved patient experiences. So we're very much linking our project to Magnish. And again, this new initiative is endorsed and supported by the Chief Director of Nursing and Midwifery and our colleagues, our Director of Nursing colleagues and our Assistant Director of Nursing colleagues. And we're also maintaining that strong collaborative partnership with our colleagues in the University of Limerick. Next slide, please. So I think that concludes my presentation. Thank you very much for your attention.
Thank you very much, Jennifer, for the presentation. And I hope you got the idea how this goes in practice. So journal club, research group, the basic information, how it works. Thank you very much, Jennifer.
Thank you.
We are continuing now with Barbara Narduzzi from Azienda Sanitaria Universitaria Friuli Centrale, Italy. Thank you. And Barbara will tell us about the experience of Italian hospitals, the experiences with journal clubs and research groups.
Grazie. Buongiorno a tutti. Oggi vi riporterò.
Thank you so much. Good morning, everybody. Today I will talk about the experience of our company as for the pilot journal club and the constitution, the creation of research group. First of all, let me introduce you the core of the project team for our company. This is me, Barbara Narduzzi, manager, and Sara Scarsini, working with me with the function of research. First of all, let me thank Professor Albisa Palese, who already in 2018 gave us the chance to collaborate in this important project. Without her, we wouldn't be able to implement all the activities that we launched and that we want to continue. We feel the interest coming from the professionals of the nursing context. First of all, let me explore the projects that we already have, the ongoing projects before the ProCare project. We have different research lines which were analyzed over the last years. Already in 2019, we had an important project where we analyzed healthcare professionals and the domains in the therapy process which could be taken by these figures. Then we analyzed, in collaboration with the universities, the possible winning models, the winning partners in the healthcare professionals practice. We did an interesting work in the handover process involving the whole company. In 2019, we were 3 companies separated from each other. We unified our good practices, the existing good practices that we had, into professional practices because we work with several professions. We also have an open line, which is about the missed care. There are some other research lines which are very interesting. I would like to mention some of them. First of all, the brain experience, where we have nurses who had the chance to have a systematic comparison in clinical and management research topics, disseminating using these brief reports on nursing, involving nurses in clinics, but also experts of some specific subjects, so as to discuss about the results emerged. Then clinical nurses could discuss about the methodology of the research and the results emerged. Now, let's come to the pilot experience of journal clubs. What about the main steps? First of all, we identified the nurses who had the chance to participate in the journal club based upon an interest expressed during an educational event held in May 2021 via webinar meeting. This event, organized by the CRO, had the purpose to organize a dissemination of the very first results of the ProCare project. On that occasion, we understood and we analyzed the nurses to be involved in the project. We shared the objectives and purposes immediately with the nursing managers, first of all, in order to have their support, which was there during every phase of the project. So I would like to thank them all. And then we also shared the objectives to be achieved. What about the goals that we wanted to achieve? First of all, improving nurses' ability to read and understand scientific publications of interest, improving them to critically review a scientific article through the identification of its research questions and constituent elements. We wanted to promote research activities in terms of generation, but also translation into practical aspects, improving their research skills with a specific focus on in their own field. We received the help of some instruments, let's say. First of all, this was the very first formal experience of journal club in our company. As our colleagues said before, time is important, and we spend so much time in our clinical activities, and we managed to give the accreditation of these activity as a training at the job. We gave 6 credits in 2021. We had 3 meetings. It was quite difficult, but because of a period, but we wanted to have face-to-face meetings because we strongly believe in the comparison and discussion among people in a vivid discussion that, of course, is better in face-to-face meetings. It was really helpful on that occasion, the documentation given by our Irish colleagues. Moreover, it was essential to have the support coming from the university and our colleague Lucia, who supported us with her competencies and skills during all the phases of the project. We translated some documents given by our Irish colleagues, so we had questions useful for the trainer during the carry out of the journal. Then we had students having agreed for critical assessment, and then we had sheet for the evaluation of training activities so as to understand weaknesses and strengths of our activities. As I was saying, we had 3 meetings. One of the main difficulties was that the group was an interdisciplinary group. So that was beautiful because, of course, we had several viewpoints. However, the difficulty was to find a cross-border topic. This is why we identified 3 main papers as transversal and cross-border papers. The first one in terms of research in nursing practice in Italy, another one about fundamental nursing care, and the third one about compassionate care. What about the results collected? Well, first of all, we increased interest in scientific articles. We improved, hopefully, we improved their reading skills. Our colleagues had a better understanding of issues relating to evidence-based practice. There was a huge enthusiasm showed despite the pandemic period because our colleagues could talk about something different from the everyday problems in clinics, so they could have an overview about something else. They also show their will to continue in these with this path for the next years. Let's now go to the most important experience of our company, which was the creation of a research group. Let me thank the components of this group who are here with us today. What about the expected outcomes? In 2021, the expected outcome was to identify the constitution of the group, to have at least 3 meetings, and we wanted to identify the main topic to be searched for. In 2022, of course, the project is going on. Here as well, we have the instrument of accreditation, which was useful because we were able to accredit hours as a training on the job for a total of 40 hours, so 40 credits. Until today, we had 5 meetings, and the effective participants now are 7. Here we had some instruments which were useful. First of all, the guidance of our coming from our Irish colleagues who supported us for the creation and maintenance of a group, the competence of the researchers, and here the competence of the university is essential because it is supporting us during every phase. We had a chance to have the accreditation of the meetings, so we had a formal acknowledgement of time spent by our colleagues, because these belong to our profession as well, to the fact of being professionals. And the basic group already had good homogeneity in terms of reading articles in English, but also in terms of skills in databases and research. We moreover had a classic training about research methodology and research skills in databases available. What about the group? The group has the participation of colleagues coming from emergency medicine and intensive care units of our company. The group is represented by colleagues coming from all over the company: Tolmezzo, San Daniele, Udine, Palmanova, Latisana. These are cities in the region of Friuli Venezia Giulia. Some colleagues had some different jobs before, some other work in different companies. As I was saying, we are 7, we are a passionate group. How have we identified the research question? Through the brainstorming instrument, we managed to identify the hot topics for the group. So first of all, ventilation and weaning, the management of enteral and parenteral nutrition, the end-of-life management, and finally, the impact of workload on nursing care and safety for the patient, of course. In order to decide our areas of interest, these areas were voted by the group, and we gave some priorities. So first of all, what is the best available evidence on the enteral and parenteral nutrition management in critical care setting? What about the next steps? Today, we identified the research and database. We are summing up the existing guidelines. What about the next steps? We will try to identify some other professionals, because now the group will have to become interdisciplinary, because the competencies and skills we need are absolutely cross-border and transversal. We have to share a draft of what we will find in our guidelines so as to extend company policy, which will be shared with the nursing and medical parts at the same time. Now, we can have a first balance, let's say, about the weaknesses and strengths. On the one hand, on the one side, it was difficult sometimes to have our regular meetings because, as I was saying, our company is very big. So we are located in Udine, and then colleagues coming from Tolmezzo or Latisana have to travel long before coming here. And so they also work in shifts, so this is why we have some difficulties. We are improving our competencies and skills together, but we have so many strengths. First of all, the big and huge enthusiasm, I would say, of my colleagues, and this is astonishing to me. When we meet together, I can see that clearly. Also, during the pandemic, of course, our colleagues had the possibility to exchange job places, so they saw the emergencies according to each specific location, so they could better understand the differences and strengths. So I would like to thank once again the managers of our offices because we were able to create the first research group of our company. Thank you so much.
This was very colorful and also, of course, rich in the content. Thank you. Let's go on. Now we have our third presenter from the hospital. He's coming from Clinica Vista Hermosa, and he will present. Oh, I'm sorry. It's a lady. I deeply apologize. She's coming from Clinica Vista Hermosa, and she will present experience of Spanish hospital. Welcome to this conference, and thank you in advance for sharing your experience with us. So please.
Hi, good morning, buongiorno, and sorry if maybe my presentation is short, but we have been working with very specific points, so we are explaining it the best as I am able. I want to share with you Okay, can you see it?
No, yes, now we can see it.
Can you see the slides?
We can see the slide, we can see you, and we will inform you if the slides will, everything will be okay with the slides, so they are supposed to move. Can you please just try if they are moving?
I tried before with Marco.
Okay, good, thank you.
Okay, so my name is Pilar Català. I'm nurse in HEIs Vista Hermosa Hospital in Alicante, and I want to share with you our experience with journal clubs in our hospital. The first questions I want to answer to make a little picture of our story start are what, when, where, and how. First of all, talking about the what, we identified different situations. The following. The nursing care protocol on enteral nutrition management through nasogastric tube was not based on the last evidences published. Also, there were differences in the nursing practice at the same unit. And there were also differences in the nursing notes and reports in the same unit. What made everything of this to make us? We thought that potentially the patient health outcomes were different according to the nurse who was in charge of the patient at each moment. And the final conclusion was that clinical variability was happening. After that, talking about the how, we wanted to assess the knowledge and practice of intensive care nurses in relation with the enteral nutrition management through nasogastric tube among patients admitted in critical care units based on the last evidences and consensus among the nursing team. And where we did it? But just at the intensive care unit in HEIs Vista Hermosa Hospital in Alicante, Spain. And we did it last year in 2021 under the ProCare project. And how we did it? We knew the journal club and the ProCare program, and we thought to make participants all the nurses and nurse assistants at the intensive care unit, including the nurse coordinators. Total of 20 participants. We developed 3 sessions with 60 minutes each session, 1 hour, and 1 per week. And in the first session, the main task was introducing the topic with one article, reading it individually, commenting in small groups, and then a plenary discussion. In second session, we want to reflect how to adapt the last evidences into practice, as we know as implementation, and proposing new articles and ideas. The last session, the third session, reaching the consensus on the protocol adapted to their context and the new documentation they have selected from the first one article. What are our conclusions? Journal clubs reveal that the intensive care nurses were unsatisfactory in level of practice due to the lack of consensus regarding this topic, and there was no updated specific protocol associated. Also, service education and training programs should be conducted for the nurses using consensus methods, such as Journal Club, to improve their knowledge and practice and to decrease clinical variability. Those participating in the journal clubs were also willing to use this for future cases. And the best of all, the hospital chief management has accepted journal clubs as a suitable method to assess the knowledge and practice for nurses, and especially when the purpose to translate the last published evidence into practice. And what are the research used and the outcomes? Here in the left side, you can see the articles they were working in. In bold characters, you have the first article they treat in the first session, and all the others, some of them in English and some of them in Spanish, are the articles they were working in the next sessions. And the outcomes produced after our journal clubs, we have now a new updated protocol. We have a new checklist for the nursing report, and we have a new nursing follow-up assessment. It's important to us to explain that we have maybe replicated the checklist in paper, and also we have contacted our software developers to implement all these protocol and all these nursing procedures into the digital clinical records of the patient. So at the beginning we started working with paper, and now we have completely inside the software all the new ideas. Now we are working with the digital version. And that's all.
Thank you very, very much for sharing your successful story with us. Thank you. And we're moving on with the experience and information from Slovenia. Mojca Strgar-Ravnik from Splošna bolnišnica Jesenice will present the Slovenian case. Please.
Thank you, Katja.
You are
Hello
welcome.
to everyone. I'm Mojca Strgar-Ravnik. I work in Jesenice General Hospital. Jesenice General Hospital is located in northwest of Slovenia, just a few meters away from Angela Bushkin Faculty of Healthcare. The General Hospital Jesenice employs 720 employees, of which are 340 nurses. I will show you the practical part of ProCare project, or how to do something if you have will to do and you have adequate support, and in our case was co-partner in project that's faculty Angela Bushkin in Jesenice. Our hospital joined the consortium of the International Research and Development Project ProCare in 2019. We were invited to the project by Angela Bushkin faculty. Collaboration and involvement in the project is priceless for us because of the better connections with the faculty in all areas of our operations and because of acquired new knowledge, exchange of experience between foreign partners, creating a working environment with management that supports the research environment, improving access to research training, promoting interdisciplinary and multidisciplinary action. Throughout the cooperation, we strive for the goal of improving cooperation between hospitals and faculties and to encourage research skill in nursing and the implementation of evidence-based practice. What is the problem? Like we hear several times today, insufficient education of already employed nurses who are key players in research in the clinical environment. It is important that training in the clinical setting does not end during the training, but also continues among nurses when they start working in nursing practice. During the education, nurses build their attitude towards research work. It has been found that the time of training has a significant impact on attitude of nurses towards research. We are all aware and agree with the results of research done in Slovenia in 2019, which found the following. Graduate nurses point out the knowledge of research work as an important obstacle in research. Nurses would be involved in research work if they had more knowledge and more time. Graduate nurses point out that limited knowledge of foreign languages is an obstacle and agree that this is the reason for not participating in research. They are not convinced of their knowledge of statistical data processing. What is encouraging, however, is that the management of institutions supports nurses in research. Nurses' research is therefore influenced by a number of factors. One of them, and certainly the most important, is the attitude towards research. Nurses can encourage research, but they can be influenced by factors that limit research, and the most common barriers to research include lack of time, lack of knowledge, workload, lack of knowledge of methodology, lack of knowledge of language, lack of knowledge of statistics, lack of knowledge of competencies and management support. As we can see, most of the obstacles are related to a lack of knowledge about something. Our goal was to remove as many barriers to research as possible and achieve the greatest effect by equipping nurses with knowledge. Which are the factors for increased research? These one are positive self-assessment of research knowledge, involvement in research, and support from colleagues and management. What is the role of management in such a place like hospital? And what have we as management done for our nurses to do more research? As part of the ProCare project, we teamed up with the faculty to co-organize a journal club event entitled Education for Research. After work, we invited employees, nurses, to do to do an education prepared for them in which they acquired knowledge for research. Based on the reviewed article, they gained knowledge on how to start research, where to find evidence-based literature, and how to identify relevant literature, and how to understand methodology from a scientific paper, and what is the whole research process from asking a research question to presenting the results. The first education was attended by 12 participants, all of whom gave positive feedback. What did we find out after the event? We gave the nurses knowledge and just removed the factors like lack of knowledge on methodology, lack of knowledge of statistics, and lack of competencies. Since the nurses attended the training at the institution in time when they're working, we showed them that they also have management support. We found that nurses do not have a lack of knowledge of professional language, but more in terms of searching literature and using foreign databases and language related to research methodology. However, with this knowledge, which empowered the nurses, we also partly influenced the lack of time and workload as we gave them additional motivation to research thinking in their work. What is the importance of cooperation, hospital, and faculty? Why was it so important to run the event as part of the ProCare project and in collaboration with the faculty? Research shows that nurses build an attitude towards research during education when professors emphasize research work, so it was important that the performer is a pedagogical worker. Without the cooperation of hospital and faculty, we would not have succeeded. Higher education institutions can put useful and new research knowledge into practice. Employees do not have enough pedagogical knowledge to carry out such education. What are the plans for our hospital in future? Our plans is to promote factors for increased research. We will organize even more such education to increase positive self-assessment of research knowledge by nurses, conducting staff meetings within the research project team, in which are representatives of each department unit who are the promoters of research, and achieving a greater involvement in research. And finally, with everything together and the financing of education, the possibility of research within the service showed employees that management supports research and gives a positive impact. And I am glad that we do it. Thank you for your attention.
Thank you, Mojca. And now, regardless our schedule, all of you who are here, I kindly ask you if we may take some time and have some discussion. I know we have lunch like scheduled in 5 minutes, but if I can steal from you 10 minutes, if there are any questions, we will be happy. So please, do you have any questions? Anything unclear? Were you maybe encouraged in some way to do the journal club in your place that you work? Yes? No? No? Online, maybe some questions from the... Nothing? Okay, thank you. Nothing from Zoom? I have something in the chat. No? No? yeah, then nothing. I mean, as far as we have seen from these cases, Ireland, Italy, Spain, and Slovenia, what we can know, what we are sure is that Irish partners, they have well-established way of work. The model is like to create the research group. I don't know, in your hospital we saw 3, 4, 5 colleagues establish the research group. This is a group of nurses who will have the wish and intent to do the debate, to read, let's say, 1 article per 2 weeks, or if you say that you will make a meeting once a month, we can call this meeting a journal club in your hospital. So you get 3, 4, 5 nurses who are interested in reading an article, and you have meetings once a month, 1 hour, let's say, and you discuss the article. This is a relatively simple way how to change the mindset. Researching is nothing terrible. Researching does not need a PhD from statistics, far from that. It's relatively uncomplicated, and a lot of you can do it. Maybe you don't have the time, maybe you think it's too heavy, but a lot of you, everyone here can do it. So from these examples, these ProCare examples that you have heard now, we encourage you to start. Okay? Good. If there are no questions, no, then thank you very, very much. I will leave you now to have a free time, and we will be back at 2 o'clock. Thank you.